treat patients. So what I'd like to cover with you today, I'm going to give you an introduction briefly. We're going to talk about the technology, a little history, how the machine actually works, usage in the clinic, indications, contraindications. I will even give you some examples of therapeutic cases, show you some evidence-based literature, not too much of that because I know that's not real interesting at times, give you some clinical recommendations, and we'll do an overview of the features and benefits. I only ask that you, if you have questions, write them down, and please, we'll address them at the end. Thank you. Let's begin. So this technology of high intensity energy, it's within an electromagnetic field. That's our treating field. And as we know, electromagnetic fields can positively influence tissue healing and repair. We use as our unit of measurement here Tesla, because Teslas are an incredible amount of energy. And there really was a Tesla, not the car, but this gentleman here, where it came from. He was an inventor, an electrical engineer, a mechanical engineer, an innovator, and a definite futurist, Nikola Tesla. But he will best be known for our conversation as the inventor of the alternating current, something we see in electrotherapy every day. So moving forward, knowing Tesla is going to be our unit of measurement for this high energy electromagnetic field, let's talk about where magnetic fields are. Think of MRIs, magnetic resonance imaging. They utilize electromagnetic fields, and they have a power or energy of about 1 Tesla. Transcranial magnetic stimulation for cases of the neurological nature. They use electromagnetic fields, but again, a capacity of 1 Tesla. The device we're talking about tonight for musculoskeletal re-education, pain management, has the capacity of 3 Tesla. So we're talking about a very, very powerful machine which can influence these cells. How it works. Again, we're talking about the machine having a coil, and this coil generates alternating sine waves to create this electromagnetic field. And with that incredible amount of energy I described to you, it causes a depolarization, which allows ion transfer through neuromuscular tissue. The 2 variables that will affect the depolarization and the energy compounds are frequency and intensity. These are your variables you can control in the device. Quick review. What is frequency? Again, frequency at its basic is how often something repeats. Think about current, our alternating current that Mr. Tesla actually developed. The faster or more cycles that occur, the higher the frequency, going from a positive to a negative, positive to a negative. What does that do? The more cycles or the faster the frequency, the better the penetration is of the current. But going back to frequencies, we have the ability to adjust frequencies. If we look at a low frequency, somewhere between 2 to 9 hertz, that's something that could absolutely increase blood flow, almost like an active recovery, but that is actually the perfect frequency for chronic pain. If we move it up to about 10 to 20 hertz, now we're really focusing on the endurance of a muscle. 20 to 30, this is where most human beings will actually have a contraction. And 40 to 70, we're increasing the volume of the muscle. When we get to 75 to 100, now we're really concentrating on strength, but also ideal for acute pain. And anything over 100 hertz is good for explosive strength and subacute pain. So not only will it have the effect of blood flow, strengthening, and explosive strength, but it addresses those three theories of pain we'll look at later: acute pain, subacute pain, and chronic pain. But then there's intensity, or our current. If we turn the machine up or increase the intensity, we get an increase or the depth of penetration. It increases the number of neurons to be depolarized, both superficially and deeper, and the intensity should be adjusted to produce the physiological response. Remember, there's muscle re-education and there's pain management. With a muscle re-education, we want to take it past that twitch to a contraction, somewhere between 20 to 30 hertz. But if we're looking for pain management, then we're just looking to get to that sensory threshold, 2 to 9 hertz, something like that. So physiological response is the key, not the number of Tesla on the dial. Remember that. So if the charge of that cell is low, damaged, weakened, injured cells, it's not going to perform at its optimal level. But by inducing high energy, and their cells need energy, we can absolutely improve the cellular electrochemistry. High energy inductive therapy can increase the ionic transfer of nutrients in, oxygen in, and minerals. But at the same time, it works to excrete toxins, dioxides. This is how we get our balance and optimize cellular function through energy. If we go back to our coil again, it has the ability to penetrate superficial, medium, adipose, and deep into the muscle. And with enough energy as it produces, you can get up to a 7-centimeter penetration. So that's very deep, very deep. A lot of energy that can penetrate deep. So what are our usages? When we say physical medicine disciplines, we're referring to any clinician that's trying to re-educate a muscle or work on pain management. Primarily physiotherapists, but not limited to. It could be a chiropractor, a sports therapist, rehabilitation, neurology, orthopedics. And again, I stress the primary therapeutic effects of this: muscle re-education, joint mobilization, and reduction of spasticity. Great neurological effect. But don't forget about acute and chronic pain. Excellent on that. So our indications: relaxation of muscular spasm, spasticity, prevention or slowing down of disuse atrophy, increasing local blood circulation, excellent at vasodilation. The big one, excellent at muscle re-education, and maintaining or increasing ranges of motion. A wonderful alternative to medication for pain, and it has a specific usage for incontinence in women with pelvic floor dysfunction. Your general parameters, again, an energy between 0.5 to 2.5 Tesla, and a frequency variance, as we remember off our slide, 5 to 100 hertz, depending on what you're trying to accomplish. Now, on the clinical side, what are some common conditions we see in the clinic: carpal tunnel, frozen shoulder, neuropathies, spasticities, disc-related injuries to the spine, spinal mobilization, tendinopathies to extremities, and again, prevention of muscular atrophy. All of these we see in the clinic that can be addressed. Contraindications: doesn't feel good over metallic implants. It's not generating any heat, so don't worry about that. But the contractions are so strong, it just doesn't feel good to the patient with a joint implant. As a rule of thumb with electrotherapy, we always try to avoid growth plates in adolescents. The amount of energy it can emit, we should keep it away from the head. A patient with cardiac disorders, a recent heart attack or surgery, blood disorders, leukemia, something serious in the bloods or platelets, drug pumps we stay away from, and our big one, any history of malignancy or space-occupying lesion, you shouldn't use it on. Patients with high fevers, a woman who's pregnant, we're avoiding low back and abdomen, and pain of unknown origin. If you don't know the cause of the pain, you wouldn't put electrodes on them, you wouldn't put a shockwave on them. Therefore, you wouldn't put the infield pro on them either. You got to know what you're treating. Don't chase a symptom, know the cause. Pretty straightforward with contraindications. Examples how it can be used: actively or unattended, and dynamically. With the smaller applicator, you can use it along with mobilization, and it can be administered through garments. So think of like right now with the COVID-19, most patients would probably object to adhesive electrodes. I don't know where those had been. And you know what happens in most clinics. We use electrodes on more than one patient. But with this, there's no electrode to put on. It's an applicator off of the tissue, off of the skin. Therefore, it's hygienically safe. And with those patients with cultural nuances, there are religions that simply will not disrobe in parts of the world. They don't have to with this. It will not lose any energy going through clothing. Whether it be a neck, a shoulder, an elbow, a hand, wrist, an ankle, foot, a knee, a hip, or a hamstring, it can be used actively or unattended, stimulating blood flow, working for pain. You can walk away. However, using it dynamically in conjunction with mobilization techniques. And again, this is a tool to be used with your manual technique. Never let your manual techniques erode or ignore them. You went to school all those years to develop good manual skills. This is to be used along with those, okay? It's just another clinical tool. So using it on shoulder, elbow, back, hamstrings again, knee, and ankle. And incontinence. Again, here's a patient in the supine position, off of the skin. Our electrode placement is over the lower abdominal pubic region. 80 hertz. Now, 0.5 to 3 Tesla. You're taking it to patient tolerance, and 20 to 30 minutes. There's an example of an incontinence treatment. We have a little video here, and let's see how it would work on back. You actually can see the contraction through the clothes. Great for a trigger point or just some spasticity there. Mobilizing. So that'll give you a flavor for the back. And how about a shoulder with some mobilization attached to it? Working some internal, external rotation. And let's look at one more on a lower extremity, a knee. Those were just 3 examples on some body parts you could use it on dynamically and actively. So really, the limitations are yourself. There's no limitations with that machine, what you could do in conjunction with mobilization. Some evidence-based literature, there's Magnetism in Medicine, 2nd edition, gives you a complete background of how electromagnetism is used in rehabilitation. And there's no shortage on evidence-based literature. Plenty of studies in pain, plenty in pain. And again, when you're talking about pain, I touched on it earlier, there's 3 theories of managing pain, and high inductive energy therapy is indicated for all. We have a low frequency endogenous opioid release, we have our gate theory, and we have our peripheral changing pain patterns. All 3 of these can be addressed. Thinking about theory 1, low and slow, I call it, chronic conditions like osteoarthritis, very effective at treating. Number 2, we have our pain gate, or inhibiting the transference of alpha, beta, and C fibers, inhibiting them from transferring to the central nervous system, somewhere between 60 to 100 hertz. Acute conditions, sprains and strains, we see them every day walking into the clinic. And least but last, we do have our modulation for subacute. Think about the ability to reboot an inflammation and get it over quicker, enabling us to get to that proliferative stage of healing. Or like a fracture, anything that's subjected to rapid change, like a fracture injury. It can address all three of these theories simultaneously or individually, depending on how you want to program the machine. Study. This one came out of Bulgaria, the hospital there in Prigorov. 40 patients, acute and chronic. Our goal, achieve pain relief. On the acute, 5 different therapies were utilized. On the chronic, 10 different therapies. Everything was based off of our Voss 1 to 10 pain scale. In this pilot study, patients began at a 7 and ended at a 1, an 87% improvement described in pain relief. Then there was 31 patients, again, of acute and chronic pain. This one out of the Czech Republic, the Faculty of Physical Education and Sport. Pain relief was our goal. 7 different modalities were used on our 1 to 10 scale. Here, immediate pain relief was observed in 67% of the patients, better than half. Ranges of motion. There's some wonderful studies, the effects of pulsed electromagnetic fields in the cervical arthritis out of Turkey, as well as loosening of total hip prosthesis. So ranges of motion, joints that are either limited to bony block or to prolonged immobilization. So joint mobilization is achieved through repetitive contractions. I alluded to before, the contractions can be so strong that combined with a physio's mobilization, it will actually help to stretch adhesions to those muscle fibers surrounding and attaching to the capsule. The repetitive contraction, it substitutes for that physical manual labor. It's doing the heavy lifting for the clinician. It is doing it together. 30 patients, contracture of knee joints. Again, this could have been to prolonged immobilization, bony block, or other. Our goal, achieve increase in range of motion. This was done versus ultrasound. And ultrasound, even to this day, is considered the standard for capsular tissue. In this study, greater joint mobility, restoration, and pain was observed with high energy inductive therapy as opposed to ultrasound. So that's a pretty bold statement. And of course, neurology. Nerve root compression. No, it's not going to heal a severed nerve, but with compressed nerves, nerve root compressions, cervical, lumbar, spine, we can help to stimulate action potential firing with the amount of energy supplied with this therapy. Plenty of literature to support. And effective right now, currently going on, a study on multiple sclerosis and cerebral palsy. So these are some neurological studies that are actually occurring right now using high energy inductive therapy. Here's a couple cases. A male had an elbow operation. He was completely incapacitated following surgery. On examination by a neurologist, severely limited range of motion, secondary to pain. He just couldn't tolerate the pain of trying to move the thing. He had uncontrolled motor skills and painful itching or paresthesia, underarm and hand. He received, for the first 4 weeks, twice a week treatment. In that twice a week treatment, he got 15 minutes to the shoulder and 15 minutes to the elbow. So a 30-minute treatment. Energy level was maximum to he could tolerate. That's a lot, okay? From week 6 to 8, he only came in once a week, and it was 20 minutes to the elbow and 20 minutes to the shoulder again. But now the energy levels were decreased to 60%. Upon re-exam after the 8 weeks, range of motion and strength was back to 80% of its normal. The paresthesia in the hand was gone, just minor physical ache with reloading of the muscles, lifting and bending. And he went back to work 100%. So our basic summary was the case showed that high energy inductive therapy was optimum for this patient who was completely incapacitated, pain-free and back to normal functional in 8 weeks. That's not a bad recovery time following surgery, when traditional care wasn't working. Chronic shoulder pain, you'll probably recognize this immediately. 57-year-old female, no history of trauma, however, had traditional therapy with minor improvement. I'm having pain in my shoulder. It's not getting better with traditional physiotherapy. On clinical examination, she couldn't lift it and you couldn't move it for her. Severely limited due to pain. Right away, that's hitting you right over that frozen shoulder. Frozen shoulder, capsular, adhesive capsulitis with a pain of 9 out of 10. She received for 3 weeks, twice a week, 5 minutes to the posterior shoulder, 5 minutes to the anterior shoulder at an energy level of 50 to 60%. The range of motion in the shoulder dramatically improved. Her pain went from a 9 to a 3. Our summary is this: in cases where traditional physiotherapy wasn't enough or not as effective, combined with high energy inductive therapy proved to be effective and take them over the top to rehabilitation. Our recommendations, now again, these are based on clinical assumptions. Acute pain, 5 visits. Chronic pain, up to 10. Strengthening, up to 10. Muscle relaxation, 5, and joint mobilization, up to 5. Again, these are assumptions, meaning it could take more, it could take less. Every patient will be different. And again, our intensity levels are adjusted to what we're trying to accomplish. A sensory threshold for pain and a motor threshold to contraction for other therapeutic effects like muscle re-education or joint mobilization. Looking at the device, it has 2 channels and 2 applicators. The large is ideal for static, unattended work, obviously supplying more energy. And the smaller one is ideal for those dynamic treatments going hand in hand with mobilization. Again, we can go up to 2.5, up to 3 with the big and 2.5 with the small. Our frequency levels, again, are between 1 to 100 hertz. And we have 3 different modes I'm going to go over with you. There's pre-programmable, favorites, and expert. To look at that, you can see programs, favorites, expert modes. To get to those, you gently push the button in for 3 seconds, and it will allow access to whichever mode you want to go into. Okay? Programs, favorites, experts. Select the channel 1 for the large applicator or channel 2 for the small. Push start and increase your intensity. That's all there's to it. Now, with the 20 pre-programmed positions, frequencies and intensities vary. We're looking at frequencies, 10 hertz, 3 hertz, 6 hertz, 10 hertz. Wow, it really does vary. And our intensity, 80% to 95% to 90 to 80, and the repetitions change. This is done to prevent accommodation. We all know we set someone up on electrotherapy and in 2 minutes you go back and check on them. I don't feel it anymore. They've accommodated to it. This will prevent that because it's fluctuating. In the favorite modes, Here's where you set the minimum frequency for frequency 1, the minimum frequency for 2, and you control your on and off times. I want it on for 3 seconds. I want it off for 6. And you can set it up after you've picked the body part, how many repetitions and your energy. You can create your own favorite ones based on outcomes you get and save them. And least but last, the expert mode. The expert mode allows you to build up to 20 different steps, up to 20 steps. Every single step is built up as follows: the frequency, the on-off time, the strength, and the repetitions. There's 1, there's 2, up to 20, and it varies. You can, any way you want to vary it arbitrarily, you pick the numbers to get the results you want. Set the time, and the total time will be calculated automatically. When it reaches its finish time, it shuts off. So there's 3 different ways of setting this up to work with it. It's non-invasive and a non-contact. Not on the skin, but it can be on clothing. Again, the energy permeates clothing without any loss of energy. It can be hands-free or unattended with the big, and with the small one, again, it allows you to work in combination with mobilization techniques. Now we can open for questions.